Riveting content. Empowering your life. Welcome to the Sphere. This episode is sponsored by
True Digital Media Consulting. You're online right now and so are your customers, but marketing has to be a consistent journey. True Digital Media Consulting can help with your online ads, organic growth, and so much more. Contact us today at 832-934-4436 or visit our website at truedigitalmediaconsulting.com.
Looking to advertise? Join the Sphere's vast demographic reach of thousands of people all over the world. Send an email today to advertise@thesphere.tv or call us at area code 832-772-7789. KOG and Company. Are your unique gifts and talents changing the world? Do you desire to belong to a community of unity? Visit KOGpassion.com to learn more about the Unleash Your Dopeness movement.
What's up, what's up, what's up? Hey, everybody out there. Welcome back to another week with the Docs. We are here. This is the Docs, your show for everything health and wellness. We missed you guys over the holiday. We hope everyone had a wonderful new year. Glad everybody's safe. Hopefully nobody did anything crazy over the last week or so, but I know we're all kind of recovering from the holidays. Teachers, you're back to work. I know y'all are hating that, but it's okay. We need you. We love you. It's your girl, Dr. Kwanzaa. Just shouting everybody out, saying welcome and hello. And we got Dr. Keisha here.
Hello, hello. Happy New Year, everybody. Welcome back. I am so excited to be back. I am Dr. Davis, your health enthusiast. I am also a pathologist specializing in the study and understanding of disease. Please catch me on Facebook at Dance Health Fitness LLC and on Instagram at KDMD_health.
Oh, I didn't shout myself out.
You shout yourself out, Miss DJ Dog.
Oh, my gosh. So, yeah, I forgot to mention. Y'all follow me on Instagram. Got lots of things coming. Working on my brainwaves meditation mix. I've been, hitting it pretty hard here lately. So, you guys come and check me out on Instagram. I got some, little snippets for you. I can't let the whole thing drop. But hit me up on Instagram at Dr_Kwanzaa MD. That's CWANZAMD. Holler at your girl. Give me some likes. Give me some follows. Let's pop this thing off. But I'm super excited because today we have a very, very special guest. One of my very dear friends. She's so much smarter than me.
Oh, whatever.
Ever since med school and college. We got Dr. Tyeshia Babineaux here. The amazing Dr. Babineaux.
Oh.
I've known Ty for more than 20 years. We 20 plus now. Right. We went to Xavier University together. Shout out XU. What's up? Greatest school on the planet. That's how we do.
Mm-hmm.
And we also went to medical school together at UTMB. And so we have known each other for many years. And Ty used to keep me in line. We used to call her Mama Ty. She used to keep us all together when we were in med school. And so we're so grateful that she's here to share her expertise. And she is a pediatrician, and she's amazing. And I actually get to see a lot of her patients.
Yes, by default.
In the ER. And so we laugh about that all the time. But we're so happy that you're here to kind of share your expertise on a topic that many people need to know about. And I think that there's a general lack of education about is just kind of basic stuff that parents should know or need to know about how to care for their kids as winter is coming. And I think you have a lot of great information to share with us. And so you want to tell everybody a little bit about yourself?
Sure. Well, I think you said the majority of the background. I am Dr. Tyeshia Babineaux. I am a general pediatrician. I practice at Texas Children's Pediatrics at the Corinthian Point practice here in Southwest Houston. I've been doing this for going on 11 years, so getting old.
Yes, man, you got to research, huh?
I know.
I know.
I just finished that this December.
Yeah,
so
yeah. I feel
so it's all over for now. And, you know, I serve patients from the ages of birth to 18 years old. So I see the whole spectrum of life. And that's exactly why I signed up for the job, because I love serving children. I love seeing them grow and thrive into healthy adults.
That's what's up. That's what's up. So, Dr. Babineaux is going to be dropping some pearls here a little bit as we kind of discuss some topics. But, man, what a weekend. If you had your TV on, probably you saw the R. Kelly documentary. Did you watch it, Keisha?
I did, off and on. I was working out while I was watching it.
Yeah? What'd you think?
I had to multitask. Not necessarily shocked, but I guess I wasn't paying attention back in the day to the depth of what was going on. So I'm very, very more surprised than I expected to be.
Really? I was like mortified, actually. I mean, so I knew about the tape. I never have seen the tape, but it's not anything that I would want to watch. I mean, obviously it involves kids and uncomfortable in an abusive situation, and so I never watched that. But you know, obviously we knew about that then, and I think from that point on, I had always like simmered down on playing his music, and you know, certainly after watching the documentary, he'll be getting no airplay from me. That's deleted off my hard drive for life.
Good.
And, you know, I think the more curious thing is people's reaction. I've been pretty surprised about the people kind of coming out and defending him. That was a little bit shocking, but I don't know. In terms of childhood development, what do you think? What do you think, Dr. Ty?
Yeah, well, childhood sexual abuse is something real. It affects over 600,000 children in just the U.S. alone. If you put it global, I'm sure it's phenomenal number, and it's something we need to pay attention to. I deal with it all the time in the practice where I am. I serve patients, and you know, a lot of people think it's the demographics of the people who are sexually abused as one or another, but it can hit anyone, any cultural, socioeconomic status. All children are vulnerable to sexual abuse, and so it's just something we have to pay attention to as their parents, aunts, uncles, caregivers, babysitters, and just watching children and making sure they're in safe environments, because the scary part about sexual abuse is usually done by someone the child actually knows.
Right.
It's people think it's, you know, stay next to your mom in the store because someone may get you. No, actually it may be a male in the home, and typically males, non-biological males in the home. Not to say all stepdads are bad or all boyfriends are bad, but it's something you have to pay attention to as a mom and or a guardian when you're taking care of children, because they're very vulnerable.
And so in your practice, you know, obviously I've seen it in the emergency department. I mean, obviously we see probably more obvious cases, you know, at that point in which they're coming to the emergency department. It's always heartbreaking, but you know, you see kids day in and day out in terms of signs that you look for, or things that, or tools or advice you could give people in terms of how to recognize signs or symptoms in a child. You have any thoughts on that?
Oh, yes, definitely. So this is kind of like a day-to-day thing. When we are doing their general healthcare screenings, especially, we take time to just talk to the children and kind of see how they're doing, take a good social history. How are you doing in school? How are you doing in your extracurricular activities? Have there been any sudden behavioral changes in the child? You know, from young to old, if you have a toddler, they may start acting out. They may start doing sexually explicit behavior. They may become clingy. They may just kind of regress. A lot of different things. And then physically, you may have children who present with different diseases over and over, like recurrent urinary tract infections or chronic constipation, abdominal pain, poor appetite, failure to thrive. There's so many things that as a general pediatrician we have to pay attention to. And so most of those are common pediatric issues that don't involve sexual abuse, but you kind of have to keep that part of your mind open, that no matter who's in front of you, you have to kind of think about it, and when you suspect it, you have to act on it.
Right. I have a question. Now, in the younger age, it really is a concern if you're concerned about or suspecting abuse. But in the teenagers, Do you think it's more downplayed, or are people coming to the office with teenagers concerned about it, or are they usually saying, oh, they're probably going to be sexually active anyway since they're a teenager?
I actually find that parents are very engaged with their teens. I often get the question of, can you check the child to see if they're sexually active? One of my favorites. Not quite. But, you have to, I spend time with my teenage patients one-on-one. We have a private discussion about those type of things in their life, whether they're exposed to drugs or sexual, we discuss their sexual health. We discuss just their mental health. And that's very important. And then during that time, I discover a lot of things, some things that have not been disclosed to anyone. And so it brings up opens a whole new situation in the office when they say, well, last year, such and such touched me and I felt uncomfortable. So we're going to have to stop and we're going to have to talk about this and figure out what's going on. So.
Well, this is a very important topic, and so I want to give a special shout out to our sponsors who are making this conversation and dialogue possible. This episode is sponsored by True Digital, and you're online right now, and so are your customers. The question is, how do you actively reach them? Marketing has to be a consistent journey, and we're here to walk with you every step of the way. True Digital Media Consulting can help with website development, online ads, your business reputation, and organic growth on search engines. Give us a call today to discuss a customized strategy for your business at 832-934-4436 or send us an email to info@truedigitalmediaconsulting.com. Mention the Sphere to receive a free 30-minute strategy consultation. Thank you so much, True Digital. So kind of going back to what you were saying, how do you open up that dialogue once you've sort of built that rapport with your patient? Mm-hmm. How do you open up that dialogue with the parent, or how do you approach that? Because it seems like it'd be a pretty difficult conversation to have. And what has your response?
Sexual abuse?
Yes.
Well, first of all, you have to understand the story. I usually really try to talk to the child and to see what's going on, first of all. And then, if there's any risk of the child being harmed, I have a duty as a health professional to report that. Mm-hmm. And so I have to bring it up to the parent. Usually I have to bring it up to the parent, unless I feel like the child disclosing it to the parent could hurt the child in some way. So sometimes I just need to just report it. So it's very sensitive. Most of the time, the cases I've dealt with, the parents are shocked because if the child kept it a secret, they're surprised that the child didn't talk to them. So I think what's important is to ask your children questions, but most of the time the parents are pretty receptive to helping their children. Mm-hmm.
That's good.
Unless I suspect it's, something involving the guardian or the parent, then we have to take it, my social worker and I will run with it and have to report it to the proper authorities.
Awesome.
No, it's good you noted that a lot of the parents are receptive. So I've got a teenager, and what can we do as parents? I know one thing that I do is we have this wonderful social media, and we've got these phones. So I just updated my son's tracking. Mm-hmm. So I track, and I have an app that I use that kind of monitors what's going on on things. Is there anything you suggest that parents could do? Because not all kids are going to speak to us. Conversations don't always happen.
There's a part of adolescence where the children would naturally start to become more private, shut down, think it's uncool to speak to their parents about stuff. And that's natural. That's natural developmental behavior. But with all the access to this information they have these days, it's different from, I hate to say it, I feel like talking like my mom. Now, when I grew up, we didn't have this access to all this extra material.
We use that dial-up.
Exactly.
And so
no
posting
I don't have anything against a nosy parent. You got to do what you have to do.
Yeah.
You need to make sure. I get my kid's phone and I say, let me do a phone check. Let me go through some history searches. Let me look at YouTube. Let me see what you've been looking at. Because if I don't stay on top of that, the world will expose my children to something I don't want them to be aware of.
And also it can be a sign to if something is going on.
Right.
If they're doing something they don't normally do.
Exactly.
Very true. And I think, one thing I found disturbing in just hearing people's comments, and it's not really a judgment on people per se, but more of a misunderstanding about childhood development. And we were kind of discussing this on the break, but even for teenagers, a comment I heard frequently was like they're 16, 17, they know what they're doing. Well, in reality, their frontal cortex, which is like the rational part of your brain, which is like the decision-making portion of your brain, is not fully developed. It doesn't develop till you're like 25 completely. Yeah. And you're kind of ruled by your amygdala, which is sort of like the
pleasure seeking.
Yeah, your pleasure center, right? And so you're going to make decisions that may not be the best for you. If we all go back, I think, to our own teenage years and childhood years and well into your 20s, I think we could all say we've made some decisions where we just weren't thinking clearly. And I think it's important to understand that we can't blame victims, and that, biologically there's reasons as to why children are more susceptible. But we got way more coming up, and I know we got to end our Facebook. So you're going to have to do, Keisha, you're going to have to walk them out on Facebook.
I know. But we're going to be talking about what? A couple of topics. Please check on Facebook, because not only this topic, but fever, vaccinations. I have a lot of friends that don't believe in them.
Lord.
Yeah.
Well, we don't subscribe to that over here at the Docs, but that's okay. But Facebook Live, we appreciate you. We love you. We thank you. We appreciate you tuning in. But more than just watching this live, we need you to subscribe to our show on all major platforms, including iTunes, SoundCloud, Google Play, and Stitcher. Review our show in iTunes with constructive feedback. And so you just go to your little podcast button and you open the search engine and you search for Docs, just DOCS, and hit subscribe. We need you to follow so you can get updated every single week. We've got great content and so much more that goes on after Facebook Live ends. So share this Facebook Live and the entire show with your family and friends, and you can donate to our mission to bring enriched and inspiring content each and every week. And you can donate at www.thesphere.tv/donate. We out of here, Facebook.
Bye.
Peace.
Take care.
Awesome. So, I know we touched on that a little bit, but the one thing that we kind of wanted to jump into as the winter months are kind of getting into full swing, and we all know how that goes.
Are they? The winter here?
I mean,
some version.
But it's beautiful.
The version of
we have winter weeks.
Winter weeks, right?
Winter evenings.
Weeks.
That's what makes it all more crazy.
And so just as, this time of year is approaching in the medical community, we start kind of gearing up, getting ready, because it's about to get pretty busy. And so one of the classic things that is always kind of interesting to me from the ER is that people don't know how to deal with fever.
Oh, yeah. Fever is so scary.
And so how do you, can you educate people on, what a fever is, what a fever means, and for your child or infant, and really what are the appropriate steps you need to take in managing that, and what would you consider?
Depending on age.
Right.
Yeah, depending on age, and what would you consider an emergency or not?
Right. So first of all, fever is a measured temperature, not the touch on the forehead,
my baby was hot.
the arm,
my baby was
100.4 degrees Fahrenheit or higher. So first of all, that's a fever. 99.8 is not a fever.
99.999?
No, it's not a fever. 100 is not a fever. But fever is actually our friend. That's what I usually try to tell the parents of the patients I serve. Is fever is our friend. Fever is the body's way of showing that it's fighting an infection, an invader. So that's your immune system at work. If you didn't mount a fever, you'd be in trouble. You'd be a sick person. You'd be going to the hospital with every cold or germ that enters your body. So fever is a good, healthy response from a healthy kid. The healthier the kids, the more fevers they're probably going to get, because they know their immune system is training on fighting germs. And so the younger children tend to get more fevers only because their immune systems are more naive. They haven't been exposed to all the germs in the world. And so when they encounter these germs, they get a fever. And most of the time, a fever is a virus, something that's going to go away. But it's hard to understand that when you don't know what's going on as a parent. So I always try to tell and advise the parents that, call our nurse line. If you have a question about fever, call the nurses. Nurses are great coaches on teaching parents about how you treat a fever. Most of it is just symptomatic supportive care at home.
Right. And what would you say would be your definition point to where you would say, hey, this fever is significant, or there's a complication related to the fever that would cause you to recommend someone to go to the emergency department?
So it really depends on a couple things. Number one, I usually pay attention to is age. So an infant under the age of 2 months, it's something we pay way more attention to. First of all, like I said, their immune systems are pretty much non-existent. They're developing their immune system, I should say. Meaning that when they get an infection, especially with bacterial and a lot of viruses, they can sometimes get more sick than an older child or a teenager. So it's important that the doctors be notified if your baby has a fever. A newborn under the age of a month is a medical emergency when the baby has a fever.
Right.
Although it may be a virus, it could be something like meningitis, a bacterial lung infection or urine infection, something that needs to be evaluated at the in an urgent matter. Most of the time, babies under the age of a month are going to wind up in the ER per the advice of their doctors.
Correct. And at which point it's prudent to know that while alarming to many parents, we do have to do a full evaluation, which includes doing blood work, getting a urinalysis through a catheter, which is the most appropriate way to get the urine and the most sterile way to get the urine, and to do a lumbar puncture, which can be scary for a lot of parents, but it's actually a very simple procedure and very helpful in terms of ensuring that your newborn is not suffering from sepsis, which is just a pretty serious infection, basically. And so those are some things that once you get to the ER, if you have a child in that age range or a newborn in that age range, it's important to understand that, yes, a lot of things are going to happen. Baby's probably going to be admitted unless it's just something so simple. But 9 times out of 10, I mean, it's an automatic admission. And so, I think just understanding that we're not trying to hurt your child. It's just we want to ensure, because we know their immune system is so fragile, that we're doing everything possible to make sure they don't get sicker. So, what is your recommendation for fever control?
So most of the time, if the child is comfortable, I just say keep them cool. Over layering and dressing the children can make someone with a fever uncomfortable. I mean, you're already hot and uncomfortable, and sometimes parents may think that sweating out a fever is the way to go. Well, if they're not drinking, they can get a little dehydrated, can lead to other problems. And sometimes the younger babies can't regulate their temperatures as well either, so it's kind of dangerous to overdress babies, especially in the sense of a fever, and it may cause a false fever, like you may have temperature elevation just because they have on too many clothes. But if the child is symptomatic and they're complaining of chills and body aches and they're fussy, giving them a fever reducer medicine, your choice of Tylenol or ibuprofen will be appropriate, age appropriate dosing. So it's best to speak with your pediatrician or family physician about the dose of medicine to give your child, because it's going to be different for different ages. Under the age of 6 months, babies should not take ibuprofen, which is Advil, Motrin. Under the age of 2 months, we don't want them having fever. They actually need to be evaluated in a medical setting. So it's important to know. So most of the time when we give like routine vaccines and one of the anticipated side effects may be a fever, then we'll give you the appropriate dosing of the medications to give.
Correct. And you can also find the information, if you don't have a doctor, you can find the information online with a pretty simple Google search. You just want to make sure that you're checking the dosage, because it is weight-based, and making sure you're giving the appropriate amount, because I think what we see on our end in the ER is underdosing quite a bit. And so, but that information is available online. You just want to be sure that, you're doing your due diligence if you don't have a primary care doctor. And you can go to any urgent care, any emergency room, although most of the time it's not an emergency unless the baby's under 2 months. But that's okay. Yeah. And we're happy to see you. In fact, we take care of it all the time. It's our pleasure. We love our kiddos, and we'll do anything for them. So, but really, really important to know. And then, in kind of to piggyback off of that, what can you break down sort of the difference between viruses and like bacterial syndromes? Because one problem that we have, like in private practice in the ER, is that I feel an overwhelming pressure to give antibiotics like mama ain't gonna be happy unless you sending the baby home on some.
Well, you have the same problem I do.
Oh, okay.
Literally, you really do.
But I feel like you probably
general
explain it better.
pediatricians probably get it even more because I'm the one that's typically shutting down the antibiotic call. So this is a virus. Your child's going to be okay. Give me a call back if they're not better in 7 to 10 days. And sometimes they're not happy hearing that, but I'm happy when the parents understand what a virus is. So a virus is different from a bacterial infection because most of the time it's a self-limited illness. The child's immune system will kill the germs. They'll be better. The worst of it is usually around day 3, especially with colds. And I was telling a parent today, I see all kids, especially the babies, on day 3 because you start off with a little runny nose and sniffles and a little cough on day 2, and then all of a sudden all this mucus just starts puling everywhere, and everyone gets very anxious because the child isn't resting and they're fussy and they're irritable. Well, it's fine. Bring them to me. That's my job. I'll check them out. I can reassure you that your child is going to be fine. However, sometimes there's complications of viruses, and that's typically where the bacterial infections come in. So like an ear infection, or if the fever isn't going away in 3 or 4 days, the child may need to be evaluated. Or if it's getting higher, the child isn't eating or drinking or looking sick, we need to see them because it could be a strep bacterial infection. It could be pneumonia because colds and flu sometimes have secondary infections, and that's where bacteria comes into play.
Do you treat all your strep? Do you treat all your strep infections?
Not all of them, because sometimes you can have a colony or a colonized person. But if they are presenting to me with a fever, feeling bad, and having all the symptoms and most of the symptoms and signs, and we confirm it with a strep test in the office, I will treat.
What about otitis media? You know, I'm like,
oh yeah, so
keeping up on the literature. Yeah, they'll tell
true.
you.
Most of the time, otitis media is a viral infection. I am one to usually treat my younger population of people because I just find it takes them a little bit longer to get over it. They have more complications with it. But the big kids, if they're walking around and playing, and you're 3, 4, 5 years old, and they're not bothered with it, and the ear doesn't look that bad, most of the time it's a virus, and we can wait it out. I give some parents the option of a watch and wait prescription where, call me back if the fever persists in a couple of days, then we'll treat. I've seen the eardrum. I know it's inflamed, but it's an option. And I think that's what most of these infectious disease specialists are recommending as a watch and wait for the bigger kids, for sure.
No, I agree with you. The watch and wait prescription usually works pretty well.
It does. It gives a solution, and also involves the parent. Like, correct. You're involved clinically in this because you know your child. If they're not getting better in a couple of days, then we need to do something about it.
Gotcha. Keisha, come on. Viruses, bacteria.
I know.
Riveting content.
Hey, this part of the show is sponsored by The Spear. Are you starting your business and looking for a place in advertising? Do you have a need to reach out to thousands of people across the world to build your brand or sell your product? Well, if so, get your product placement and advertising needs handled right here at The Sphere. We offer a wide variety of content, including iTunes, Google Play, SoundCloud, YouTube, and Stitcher. Plus, we have a vast demographic, reaching from within the United States as well as the modern countries across the globe. So our enriched content and inspiring dialogue, coupled with your strategic ad, is surely to hit the mark every time. Just give us a call at 832-772-7789 or send an email to advertise@thespear.tv.
Nice.
I had to throw that in there. I had to.
I got to hear you get all hype about your pathology stuff.
The virus and the stuff.
Let's break it down.
So in simplistic terms, let's go back to like med school days or the simplistic days. The virus, to me, think of it as like, it's a pathogen, so it's always going to cause a problem. The problem is it's one of like those bullies that can't bully somebody without their background or their backup. So it has to live within a cell in order to replicate or do what it needs to. But a bacteria is like a cell, just like made up cells, or all our body's made up of cells. So it can cause injury without having to get inside of our cell. But the thing is, there's like good bacteria. If you have a virus, the virus is a pathogen. It shouldn't be there. But there's a lot of bacteria, right? Sitting on our skin all day, sitting inside our body. That's like the good bacteria. So not all bacteria is pathogen. So even when we culture things on the plate, we have to know, okay, this is a good bacteria. Okay, this is a bacteria that shouldn't be there, depending on where we got the specimen from. And then we kind of, let you know. So bacteria is like a bad cell, and what happens is it just replicates and causes havoc. Yeah. And then some of the havoc is also that our own cells are fighting the infection. So when they start secreting all their things and their weapons, then that kind of make things a little bit, inflamed or redness or the swelling and stuff like that.
Nice
Cool.
breakdown. I know. Dr. Keisha be breaking it down, man.
I like the cell outside the cell.
So it also makes sense, right, why treatment is easier to develop something that doesn't look like the rest of you because you can attack it. But if you got a virus, kind of like a cancer or a cell that looks similar to yourself, it's inside of it, you're not going to have medicines easily just to treat that.
Right.
Well, yeah, you got your antiretrovirals.
Still that. Yeah. I'm going to start using that at work.
It is a
Thank
good
you,
one.
Dr. Keisha.
I need to put that in my back pocket.
Put that in my little repertoire of explanations. That was a good one. That's a good one. Okay. Cool little breakdown. That's why I like you. That's why you're so good. Oh man. Oh, that's you. That's you.
Go back to another
I know. And Dr. Keisha, man, because you're doing so well over there, just breaking stuff down. You got to break down our last sponsor.
I guess I'm kind of dope. So let me talk about some dope ad. KOG and Company. Do you have your unique gifts and talents? Are they changing the world? Are your talents needing to be unleashed? Well, Unleash Your Dopeness is a people empowerment movement built to encourage the masses and operate outside of the fears. If you have the gall to recklessly pursue your dreams and passions, join the thousands of others as we unleash the greatness that dwells within. So if you want to shop this dope gear, go to kogpassion.com. That is kogpassion.com and use the coupon code DOPE for dope. 10% off and unleash your dopeness apparel. Act now. Sizes are selling out fast. You got the T-shirts.
Yeah, those I like those hoodies. Why we always?
If I wore that hoodie,
we're gonna get a hoodie.
You know why I'm afraid? Because my son then won't want to be affiliated with me.
Why?
Because he'll think I'll look cooler than him. Anything I do that's kind of, even if I can do the whip and nay, if I can kind of do something, it's like, oh, you got it. You're doing it wrong. You can't. I have to
get your sweatshirt. I'm gonna get you something fly, and then you gotta wear it just cause.
I will, and I'm gonna put his initials on the side.
Right.
JR's mom.
Right. You gotta put a big old patch with his face on it. But anyway, back to the topic here. So another really important thing that we see as the winter months come, and we've been saying it already, obviously is RSV, and then also reactive airway disease. And so, can you sort of explain what the difference is, what RSV is, and the basics on what you think parents should know? Because I think what we find from my perspective in the emergency department is we usually end up seeing kids again who've already been diagnosed or they've been seen, but maybe they don't quite understand how long it's going to last or, some of the complications that could develop. So if you could shed a little light, just like what RSV is versus what reactive airway.
So RSV is respiratory syncytial virus, another one of those viruses that lives in the cells. I just got my refresher. So this virus typically infects younger children, toddlers, babies, and can cause inflammation in their small airways. It produces a lot of mucus. So this is one of those upper respiratory infections where the kid's full of mucus. Parents, they can't keep their nose clear. And the thing with the little ones is that, there's no approved cough and cold medicine to treat this. Right. So, and it's no antibiotics that's going to treat it because it is a virus. So RSV typically will last a little bit longer than your common cold. Some of the complications of RSV is going to be respiratory distress. Our most vulnerable are those little ones with chronic lung disease, like our preemies. They typically will get very sick, a lot needing to be hospitalized for respiratory support. And then some of the kids, even when they're healthy, they may wheeze with RSV, like someone you may know with asthma or what Kwanzaa refer to as RAD, which is reactive airway disease. That's when a child has a chronic recurrent cough or wheezing pattern It could be when they get a cold, or it could be from just their genetic makeup where their hypersensitivity shows up when they exercise or when they're exposed to irritants and pollen and smoke. So it's two different ball games. Now, RSV can lead to children developing reactive airway disease, especially if you have a genetic predisposition for asthma. So that's the difference. It's recent studies show that treating RSV with inhalers and albuterol or the nebulizer machines, what I always get a request for, doesn't always work. It helps in some, and sometimes I may give it a trial in the office, especially if you have a predisposition for reactive airway disease due to family history, and just depending on how the baby looks or the toddler looks. But RSV it's a bad cold. That's the one. And when I hear parents say a bad cold, I will accept that about RSV. RSV is a bad cold because it does infect the lower airways, so it's a little bit more severe.
Are you still giving steroids?
We do not give steroids for RSV.
Okay.
No, RSV does not respond to steroids.
Okay. My bad. No, I mean, I read the literature on it, but
no, it doesn't.
Interestingly, like catching up, it's just practice patterns, right? And so even as physicians, we all keep up on the literature, but it's interesting because I think, when I was in training, it was pretty much standard. We all gave steroids, and then, you have to relearn that literature.
Right.
And
keep up with it.
Right. And keep up and say, hey, this is not the standard anymore. I mean, I had read the guidelines, and so it's interesting kind of breaking, the mold on practice patterns with how we treat these disease processes.
Right.
And the other thing is, I think that's important. The reason I always say reactive airway disease is because as an emergency provider, it's not appropriate for me to be diagnosing your child with asthma, and because that's something that needs to be handled by your primary care. And so I'm very cautious about using that word because I don't want to label anyone. I haven't done the appropriate testing to say you have asthma. And so there is a distinction there. And so that's kind of why we kind of use that terminology until you get an appropriate diagnosis by your primary care doctor.
It's definitely hard to distinguish because if you have a child that get recurrent episodes of wheezing, typically more than 2, maybe about 3 times where they've wheezed in the winter, then at that point I'm like, this is probably RAD, reactive airway disease, or some kind of chronic inflammation state that may need to be treated like we would treat a child with asthma.
Got you. Man, this has been super informative. Okay, flu. So we're going to hit 2 things and then we're going to hop out of here. But it's flu season. What does everybody need to know?
So flu season, get immunized for the flu. I know it's a lot of taboo about the flu shot. Oh my goodness. But the flu shot I will admit it's not perfect, but it does help decrease the severity of flu symptoms if you are exposed to the flu. So immunize your families, especially the young. Our older members of our population are most vulnerable to the flu. Pregnant women postpartum, your immune systems react a little differently to the flu, and most of the hospitalizations come from that population of people. So it's very important to immunize, especially if you have around anyone with any chronic diseases, diabetes, or lung disease, asthma. You need a flu shot. That's number one. So I always tell my parents and they don't want their child to go through the discomfort of the shot. Rather you go through this 1 second of discomfort than 2 weeks of flu and possible significant secondary issues and hospitalizations. And I just break it down, and even death, because the flu can kill you.
Yeah.
And it's serious. So I definitely promote the flu shot. And then also just common practices, just hygiene, washing your hands, use soap and water and wash your hands for at least 20 seconds. If you can't get to water, use sanitizer. I use both. I'm probably overdoing it, but it's very important. Keeping your hands out of your eyes, your mouth, your mucous membranes, especially if you haven't washed it. That's why children get sick so much at school, because they're always touching stuff. Their environment is contaminated. And so they come home with these germs, sometimes even on their person. So their younger siblings, they come home and get exposed to the siblings who've been at school all day. So it's very important to just take care of your basic hygiene and wash your hands before you eat. coming out the restroom, stuff like that. That bothers me when I see people coming out the restroom not washing their hands. Is really disgusting.
Of course, right?
So
We're going to end up with some hepatitis.
Right, exactly. That's a whole nother
Gotcha.
topic.
I know. And then really quickly again, that's a virus again, but we do have a treatment for that. And so we do prescribe an antiviral for that if you do test positive for the flu, if you're in a 2-day window.
2-day window. That's
and
important.
You can still get the flu if you have the virus, but that's because there is many different types, serotypes of this virus. So the ones that we been able to make are 3 different ones usually. 2 types of A and B, but what happens is that this virus, just like the bacteria, these things replicate, they change. And so you can't always just, think that someone's going to make, a different type to cover every different one.
Right.
So it's a killed virus. So there's no way the killed virus is going to suddenly come back to life and activate in your body. It's just put in there, kind of like when you have the allergy shots. It's inactivated so your body's immune system will react and be ready for if the virus ever comes into their
That's right.
play. But it's morphing, and last year there was a type that's not covered by the
It
flu.
was a horrible season.
It was off the chain.
We all have memories of that season.
But it's better to be safe than sorry.
But the good thing about last year, despite the shot not working so well, I know I found in my practice that those who were immunized didn't get as sick as those who were not.
That's a great point.
Yeah.
And it was actually data out that, a lot of the children who passed away were not immunized.
Nice,
It was a lot of pediatric deaths last year from the flu.
Yeah.
Last year was a bad year.
Yes, it was horrible.
Like a really bad flu
was.
season. I haven't really. We're seeing flu starting to crop
It's
up,
just
but it's
starting.
It ain't like last year.
It's not.
I felt like
by now January it was
on
throttle.
and popping.
Yes,
it was on and popping, and it was pretty bad. But and so to see, the really devastating ramifications of someone going into shock or developing a secondary bacterial infection and sepsis is really it's pretty hard to watch, especially for a kiddo. So definitely do your due diligence and get your immunizations in. And I think our last take home is, can you please educate our listeners on the importance of immunizations?
Okay, well this is a broad topic. You're gonna have a lot of different opinions about immunizations, but I'm just gonna let you know.
Are there really?
Well,
do we still
medical
have
opinions? I would say no, because
Okay.
we know
Yeah, I
that
was about to say.
immunizations save lives.
Yes.
But on Facebook and blogs and
It's a
superstars' opinions and the
healthcare view.
anti-vaccine sites, be careful, because those things are not backed up by any medical evidence that's valid.
Exactly.
And so what's important is that your child take their immunization series as a schedule, because that's how it's studied. I have sometimes parents, well, can I get 2 here? And then can I come back? And they ask for alternative schedules. And it can be a little bit difficult. Get your children immunized. Very important. And if you come to your yearly checkups with your general pediatrician, they will make sure you stay on track with getting your scheduled doses. So,
do immunizations cause autism?
immunizations do not cause autism.
Thank you.
I have 2 girls. They got all their shots. If I thought they caused autism, I definitely would not immunize my own kids.
And that researcher went to jail.
Yes.
By the way, everyone.
Flawed evidence, flawed
Flawed.
study, big time. So be careful where you're getting your information.
Yeah, there's tons of research on it. It's still hard to believe that, as a medical provider, that, people are holding on to those beliefs. But, honestly, as to the best of our knowledge, and we would never tell you anything that we know to be in error. This has been proven after study that this is incorrect information, and that immunization saves lives. It saves children's lives. It saves people's lives, adults' lives,
everyone.
And it's super, super important. That's just really the one thing that we wanted to touch on. If we could refresh that bit of knowledge in people's brain and reassure you, please get your children immunized, and for older persons, get your pneumococcal vaccine, or in your there's a whole bunch of other ones, but make sure you get your vaccines taken care of. It can save your life, and so
your life and those others, those whose
Yes.
immune system is not
It's
strong, and you're the
Yes,
carrier,
yes.
and they can get exposed.
oh my gosh,
That
and
is so
please don't
true.
bring your
Yeah.
newborns to the ER if they're not sick, please.
Oh, yeah, that's a big one.
I just wanted to throw that
Yeah.
that little tidbit out there, but
That's a big one.
Dr. Babineaux, you were awesome. You're so
you.
informative.
Thank
We're so
you.
happy you came. You're going to have to come back. We really appreciate you spending your evening here with us. I know you got the kids at home.
Oh, yeah.
Well, at dance
Phone's
practice right
buzzing
now.
already.
Buzzing. So we
Yes.
appreciate your time, and we want to thank you guys for tuning in. And again, please subscribe to the podcast on iTunes. Just roll over to your podcast app, hit Docs in the search bar, and pull us up. Look for our cross logo, and we're there. And I'm Dr. Kwanzaa MD. And again, you can get me on Facebook at Dr. Kwanzaa MD or Instagram at Dr._Kwanzaa MD. And I'll be happy to answer any questions that you need. Dr. Keish?
Don't forget, I'm Dr. Keisha. Please check me out on Facebook, Dance Health Fitness LLC. Everything about keeping health mentally, physically, and mind, body, and soul is important. Please also check me on Instagram at KDMD_health. And soon to be, don't check out AskPath. The website is up, askpath.net, but it will be fully functional very soon. I will let you know. So any questions that you have about lab tests, biopsies that you had, or just how the body works, I can answer those for you.
And you know what? And I love Dr. Babineaux, and in fact, I refer her a plenty of patients.
It goes back and forth.
Awesome.
It's a give-take
I
relationship.
was messing with her because I was text her. Like,
I always see her middle name pop up, and I'm not going to call you out like that.
it's
on
okay.
all of your
Aretha,
referrals.
come on. It's all right. It's all right.
Kwanzaa,
It's all right.
Aretha,
I know.
Pinkney.
Don't be talking about me giving antibiotics all the time. But Dr. Babineaux is amazing. And
Well,
if you
thank
need
you.
a primary care provider for your child, let the people know where they can find you.
Texas Children's Pediatrics. You can go to the Texas Children's Pediatric.org website and look me up at the Corinthian Point Practice. Located at 5505 West Orange, Suite 100. And we are happy to serve you. We also have a walk-in clinic, too. We have an awesome nurse practitioner who can see your child when they're acutely sick. So it's a good place to go instead of going to the ER. So.
Hey, she's Docs approved, y'all. So look her up if you need a doctor for your child. And we're so appreciative to have you. And we just thank you for spending time with us today.
Thank
Yes,
you.
thank you.
All right. Peace out, y'all.
Take care.